Hello everyone. This video is going to provide you with a brief overview of the APGAR score. So the weekly forms that you've been filling out with feedback on clear points and muddy points, APGAR seem to be a bit of a muddy point for people. So hopefully this video will help to clarify that information. Keep in mind this resource is designed for students. It does not replace medical advice, nor does it replace attending class. If you have an emergency, of course, you're always going to go to the nearest emergency department or call 911. Before we start talking about APGAR, I'd like to speak with you a little bit about neonatal resuscitation. I talked a little bit about the Neonatal Resuscitation Program, or NRP, in class, and the guidelines of the Neonatal Resuscitation Program in Canada and the US tell us that the APGAR score is useful for giving us information about how the newborn's overall health status is and maybe how they respond to resuscitation if we have to start resuscitation. But really it's meant to give us an idea of what's going on with transition, that transition from fetal to newborn life. Resuscitation, when it has to occur, it may need to be started before 1 minute of life. So the APGAR score, the take-home message is the APGAR score is not used to determine the need for initial resuscitation. It sort of gives us an overall picture, but it doesn't tell us that we need to do resuscitation, that we need to implement resuscitative measures, what steps we need to do, or when to use them or how to use them. So please do keep that in mind because I could have a baby that at 30 seconds of life, I've dried them, warmed them, stimulated them, maybe even suctioned them if they had some secretions, and they're still not breathing. I'm going to need to start positive pressure ventilation, giving that baby breaths with a bag and mask before I'm even sort of calculating the APGAR. So just keep that in mind when we're talking about APGAR. So we've talked about this, when to do the APGAR. It's at 1 minute of life and 5 minutes of life. If the score is less than 7, at 5 minutes of life, keep repeating the assessment every 5 minutes for up to 20 minutes. That's what NRP tells us to do as well. You'll see there's a picture here. This is Dr. Virginia APGAR, and it's kind of cool. We're actually going to use Dr. APGAR's surname or last name to help us with an acronym to remember each of the components of the APGAR today. So there are 5 components. Each category is assigned a value of 0, 1, or 2. You're going to add them up. A score of 7 to 10 is considered reassuring, so that would be considered to be sort of a normal transition, babies transitioning well from fetal life to newborn life. A score of 4 to 6 is considered abnormal. We would be more concerned with this baby, and a score of 0 to 3 is considered low in both full-term and preterm babies. Now, I don't want to get too much into the research, but just for your interest, a 1 minute score, APGAR score of 0 to 3 does not predict any individual infant's outcome necessarily. A 5 minute APGAR score of 0 to 3 is correlated, so correlation is not causation, correlated with neonatal mortality in large population studies, but it doesn't necessarily predict individual future neurological dysfunction. So there's a lot of research and literature out there. Population studies have really reassured us that most infants with low APGAR scores, for example, won't develop cerebral palsy, that kind of thing. So you can look at the literature if you want more information on that. If that's something you're interested in, speak to me. We can chat offline for sure. So the first letter is A. So A stands for appearance, and that is when we're looking at skin color. So is the baby pale or blue? They get a 0. Do they have acrocyanosis, which most babies do have a little bit of acrocyanosis when they're born because of that fetal to newborn circulation. That peripheral circulation hasn't quite developed yet. So most babies do get a 1 for this category. And no cyanosis would be 2, which would be more rare. If the infant has darker skin, the best way to look for cyanosis is to look at the nail beds, the lips and tongue. Sometimes you can see a little bit on the palms of the hands and soles of the feet as well. And we talked about that in class briefly. Here's a couple more photos of babies with acrocyanosis. You can see the color difference of the feet and hands compared to the rest of the body. A photo from your Perry textbook and also from Stanford Newborn Nursery. They have an amazing site if you're looking for any pictures of babies in different conditions. The P is the pulse. This is the heart rate. So this is, if the baby has no heartbeat, it's a 0. If their heart rate's less than 100, it's a 1. If the heart rate's more than 100, it's 2. you are going to be using a stethoscope, and you'll be checking the apical pulse with your stethoscope. And if you're in a resuscitation and you're counting really quickly, we count for 6 seconds, we multiply it by 10, but to get a good thorough assessment, you'll want to assess for a full minute. Sometimes in a resuscitation, your baby will have ECG leads placed on, so you'll have a monitor, but we still use the stethoscope. The G is grimace or reflex irritability. This is the baby's response to stimulation. So if there's no response at all, it's 0. If they grimace in response to being stimulated, it's a 1. Or if they cry, cough, or sneeze, doesn't have to be all 3, one of those things will do, then they get a 2. The next A is activity. And when you think about activity, think about muscle tone. So are they really hypotonic? There's no muscle tone. They're really floppy. They would get a 0. If they have a little bit of tone and flexion, they would get a 1. So if you think back to those photos I showed you when we were talking about thermoregulation, the term baby versus the preterm baby, those preterm babies would just have some tone and flexion. Some of them might have been quite floppy as well. Active flexion that resist extension. So when you sort of pull on their arm, I can imagine sort of trying to extend this baby's arm, it would sort of recoil back up. So that would be active flexion. This baby looks like he's nicely actively flexed. The last one is R, respirations or respiratory effort or breathing effort. Are they making respiratory effort? Are they trying to breathe? Or they would get a 0. Or do they have slow and irregular breathing? They would get a 1. And if they have a strong cry, they would get a 2. Or if they're breathing vigorously, it would be a 2. So this scoring tool, the way that I just showed it to you, divided by APGAR, does correlate with what's in your textbook, but use whatever works for you to help you remember. This is really helpful, as I mentioned, for a rapid assessment of the newborn's transition to extrauterine life based on those 5 signs: your heart rate, your respiratory rate, your muscle tone, reflex irritability, and generalized skin color, whether they have cyanosis or look sort of like they have pale undertone to their skin. Evaluations are made at 1 minute and 5 minutes. And again, resuscitation can occur at any point, and we're not going to wait until that 1 minute mark. And what the Canadian Pediatric Society tells us, and also the American Academy of Pediatrics with NRP tells us, all births require healthcare providers who are in attendance to be certified, or we don't really say certified, but have completed a neonatal resuscitation program and have completed that education. So it's really, really important. And that's why I talk about NRP in this class, but I don't go too much into detail, because if you work in a perinatal area later, you're going to actually be trained in NRP. So you wanted some practice questions. I heard you, and here you go. So I'm going to get you to pause the video here. You have a 39-week gestation baby who's born after an uncomplicated pregnancy and birth. Their appearance, they're pink with some acrocyanosis. What's your score going to be? Your pulse is 120, so it's over 100, regular rate and rhythm. The baby grimaces, they cry and pull away when they're stimulated. They're moving all of their limbs actively. This is a very happy baby, and you're a very happy nurse. And the respirations, they are really crying loudly, so you know that their respirations are normal. So pause the video. What is the score? All right, if you said 9, you're correct. So all of these scores, they would have received 2, except for appearance and color. They would have received 1. Here's another baby, a 32-week gestation baby who was born via emergency C-section. There was an abnormal fetal heart rate. Mom had some other health issues happening. So when this baby's born, they have blue extremities and pink undertones in the body, which is pretty much known as acrocyanosis. Their pulse is 75. It's irregular, less than 100. They have weak response to stimulus. For their grimace and their activity, they have limited movement, and their respirations, they have irregular breathing. So what would you say this score was? I'll let you pause the video now. This baby has a score of 5. They've received 1 for each of the criteria. Here's another one for you to practice. A 42-week gestation baby is born via cesarean section birth due to decreased fetal movement and abnormal fetal heart rate, fetal health surveillance tracings. Your findings: the baby is pale all over. The pulse is 40. It's weak and irregular. There's no response to stimuli with the grimace. Their activity, they have no tone and no movement. And their respirations, they are trying to make respiratory effort, but it is irregular. So what would this one be? I'll let you pause it. So pale all over is 0. They get 1 for their heart rate. They get no response, which is 0 for grimace. They have no activity. They're completely floppy. They get 0 for activity, and they get 1 for respiration. So this one would get a 2. So thanks, everyone. I hope that this was helpful for you. I will look forward to your feedback. And if you have any questions, as always, reach out. Thanks.